A very warm welcome to another episode of Fauza's Diary. If you are looking for something little and yet inspiring, then you have stumbled upon the right show. That's the beauty about my diaries. They inspire us, they encourage us, but also they make us think and challenge us sometimes. Joining me today on this particular conversation is a dear sister friend, Dr. AREZO MOTEVALI. We are here today because October is I always feel October, there is a lot of awareness about women health and what's happening, what can we do, what do we have to be educated and to know. And so I felt led that I could have one of my dear friends, Dr. AREZO, to join me on this diary. And we just talk about women health in breast cancer awareness. And I am so thrilled that she said yes, of course. It's not her first time to be on the show. And I'm so glad and so excited that she's here again with you, to share about women health and the topic about breast cancer awareness, which is something that, I actually also follow very closely. And thank you so much, Dr. AREZO, for being here with me and with our viewers who will be joining us today. Yeah, I'm just so happy that you said yes to have this conversation with me. Thank you so much. So our topic today is about breast cancer awareness, Dr. AREZO. And if we can go direct on this conversation, what is really cancer and what is breast cancer? For those who they don't really, know about this topic, and they, sometimes with people, people don't just follow some of these things, or, yeah, of interest.
Yeah. First of all, good evening to you and to whoever watched this video. Thank you so much for inviting me. So today we are here to get some few information to people to raise their awareness about breast cancer, how they can prevent it. We are not talking about the treatment because we want to focus on how we can prevent this disease. And you know that October is the month of awareness. Everywhere you can see this pink carbon, which is for the breast cancer screening test. So let me start with cancer. What is cancer? Cancer is the broad term for class of disease characterized by abnormal cell that grow and invade the healthy cell in the body. So means that cancer grows when a cell DNA is damaged. But how and why the DNA damage is still unknown. But the damage could be caused by genetics, by environmental and lifestyle factor.
Mm-hmm.
And in most cases, combination of two factors. So most patients will never know exactly what caused their cancer. However, there are certain established risk factors that associated with breast cancer, and we will talk about it later.
Mm-hmm. Okay, thank you for sharing that, because I think sometimes some of these things we don't even, it's such a sensitive thing that a scaring thing as well at the same time.
Yeah.
For most of us, especially if you are not in the medical field. So I would like for you to share also with us today, Dr. AREZO, what are the signs and symptoms for breast cancer, and what should I do, or what can we do collectively, to prevent breast cancer? Is that something that is doable? Because
Yeah.
you hear a lot of stories about breast cancer.
Yeah, breast cancer, the name or cancer is like a scary things, but if we know how we can prevent it, is not that much scary.
Mm-hmm.
Okay, so that's why we are here to share, first of all, some sign and symptom. So different people have different symptoms, okay, for breast cancer, but some people even do not have any sign and symptom, but some warning sign of the breast cancer I will share with you here. So one of them is any new lump in breast or underarm. So we will talk about like more about what is lump also.
Mm-hmm.
So thickening or swelling of part of the breast, irritation or dimpling of breast skin, any redness or flaky skin in the nipple area or in the breast, pulling in of the nipple or the nipple area or other breast area. Any nipple discharge other than milk, like, for example, if there is a discharge of blood, especially. Any changes in size or shape of the breast, pain in any area of the breast. So these are the main symptoms that if we find out this kind of symptom, we have to visit doctors. Okay, so, but let me clarify these lumps. Okay, because sometimes that some people, when they are, doing the self-exam, okay, they're feeling that there is lumps. Okay, but many condition can cause these lumps in the breast. Okay, and all of them is not cancerous. So some of them is other medical condition, like, for example, two of the main reason for this lump is fibrocystic and also is a cyst. So these are the conditions that we don't say these are fibrocystic disease. We never say. We say fibrocystic breast or cyst in the breast means that these are not disease. These are a kind of condition that sometimes has happened, and in most of the cases they are not cancerous. But anyway, if we see something like this, we have to visit doctor. Further investigation will go, and then finally we find out that this is, like, for example, is not cancer, it's fibrocystic only. So, and what is this fibrocystic happens? Like sometimes, especially in women, because of this hormonal fluctuation during the monthly menstrual cycle. So these lumps get more painful, get more lumpy. So that's why they feel like this hardness in the breast. So sometimes this cyst also, which is a small fluid filled sacs that can develop in the breast. This also sometimes happen in the women who are in the premenopausal period, like from age of 35 to 50. And these can be diagnosed by ultrasonic. So means that if somebody visit the doctor, they can find out this easily by ultrasonic.
Okay. This is something very interesting because I think those who they follow me, they know I've been an open book, and I've shared about my challenges with my breast issues, especially in 2018, 2019, just before COVID. And it's interesting because all those things you have shared, I have them, like I have all these fibrotic cysts and all that. And sometimes when I'm ovulating, they actually get more sensitive, and they sometimes they fill up. So I have had to do even mammograms, ultrasound, and biopsy. But also when it's full, my doctor always says to me that they have to, to do a minor procedure to take the liquid out. And it's such an interesting topic, honestly. But thank you so much for sharing that, because these are topics that sometimes I think women, we are just not comfortable to share openly and to discuss about these things. However, these are matters that we have to learn and be mindful and, be aware about. But I would like for you to share about the risk factors. What are the risks?
Sure. Yeah, just let me to add something about what this lump look like, and then go to risk factor. Okay, because sometimes when we say lump, because maybe somebody asked what is lump means. See, means lumps means when you do self-examination in your breast, you can see some thick spot around the breast tissue or underarm even, or the size can be small or even large as a golf ball. And it can be round, it can be smooth, it can be movable, or it can be hard. So it can be with pain or without pain. But 60 to 80% of this kind of symptom are non-cancerous. But the only things that once we see something, we have to visit doctor. But we should not be panic and worry, because most of the cases, it's maybe related to fibrocystic. Okay. Okay. Regarding the
risk factor.
A risk factor. Okay. So can we tell about, I don't know, you want to talk about the screening test, how we can? Just, I will add also the screening test. So means that, okay, if we see this kind of symptom, okay, what we should do? So when we visit the doctors, so they do mammography, as you already mentioned, mammography, ultrasonic, MRI. It depends on which level or a stage we are, or it's the high risk. For example, if women is the high risk, maybe they do MRI also. Sometimes biopsy maybe. But for the women from 18 years old, every month should do the self-examination every month. So this is the one that from the age of 18, women should do. And after 40, every year should do the mammography. This is the routine that the women should take care of this. Yeah. So now we are going to go to the risk factor. Okay. This is very important. Risk factor, there is two kinds of risk factor. The one that we cannot change it and the one that we can change it. First, the one that we cannot change, like getting older. We have no control of our age. Yeah. So the risk for breast cancer increase with age. Most breast cancer are diagnosed after age of 50. So other factor is genetic mutation. So women who have inherited this mutation, which is from parents, so they have a mutation in two genes. The gene is a BRCA1 and BRCA2. The women who have mutation in these two genes, they are most likely to have breast cancer. Other factor is having dense breast. Sometimes, especially in the young women, their breast is very dense, means the connective tissue is more than the fatty. So that's why if there is any cancer or early stage of cancer, they cannot diagnose this through even mammography or sometimes even ultrasonic. So that's why if they have dense breasts, they should do this routine screening test to be sure that there is no cancer. And if they need, maybe they need biopsy or more tests to avoid, missing the early stage of the cancer. Other factor is personal history of breast cancer. So someone who has any experience of the breast cancer, so most likely to get in another breast also. So family history of breast or ovarian cancer. So whoever has the first degree relative, they have this kind of history. So they are more likely to get breast cancer. And another factor is the previous treatment with radiotherapy. So whoever has radiotherapy, they are most likely to get breast cancer. So exposure to some drugs. So there is one drug which is D-ethylestrobestol, which is given to the pregnant woman for preventing the miscarriage. But this is between 1940 and 1971. But after that, the study shows the women who take this medicine, they are most likely to take to get the risk of the breast cancer. So right now, this medication is very limited, will be prescribed. So these are the factors which we cannot change, but there are the factors that we have control on it, like not being physically active. So women who are not physically active have a higher risk of getting breast cancer. And if we are physically active, we can reduce this risk by 20%, which is, I think it's too much. So healthy diet, less sugar, more fruit, vegetable, no smoking. These are that can decrease the risk of getting breast cancer. Being overweight and having obesity, especially after menopause, so getting women in the higher risk of breast cancer. Taking hormones. Hormones, you know, some women after menopause, they are taking the hormones, estrogen, progesterone hormones, which we say hormone replacement therapy. So the women who take this, they are most likely to get breast cancer. Or the women who take these contraceptive pills more than 5 years, they are also mostly in the getting breast cancer. That's why the women who take this contraceptive more than 5 years, then the doctors normally tell them that to stop it for some years and then again they can take. So drinking alcohol also is one of the risk factor. And reproductive history means having the first pregnancy after the age of 30, not breastfeeding, never having a full-term pregnancy, also can raise the breast cancer risk. So these are the risks that we can control it.
Wow, and there are so many. I really hope that we can at least at least being fit, physical, and eating healthy. I think that's something that I can do.
Yeah, sure.
Yeah,
Exactly.
you talked about the genetic test BRCA. Who should be tested for this?
Yeah, see, this test, which is the genetic test, that normally these are the expensive tests. So, and normally it's not advised to, you know, every woman to do it. But the women who are at the high risk of breast cancer, which they have, for example, breast cancer diagnosed before age of 50, or they have in the family, they have male breast cancer at any age, or multiple relative on the same side of the family, they have breast cancer, especially first degree relative like mother, daughter, sister, like this. Whoever who have multiple breast cancer, or they have ovarian cancer in their family side, or especially in the first first degree relative, or any significant history of the same family side of diagnosis, even in the men, young prostate cancer, or ovarian cancer, melanoma, or pancreatic cancer. If they have in their family this kind of cancer, these people are advised to get this genetic test. And when they do this BRCA1 and BRCA2, if it's negative, so it's a good news, means they are not at the high risk are getting, but it doesn't mean that they never get breast cancer, but means that they are not in the high risk. But whoever this test get positive, means they should do a very strict screening test for themselves, but also it doesn't mean that they 100% sure they get cancer, but anyway, they are considered as a high-risk women, and they should do this screening test under the supervision of the doctors.
Wow. Okay. So I've learned a new term today, BRCAs. That's a new term I've learned. So thank you for taking me and my viewers on a journey of medical today, Dr. AREZO. Before we wind up, our time is almost up, but before we wind up, there is always this question, women sort of talk about, hair relaxing, especially for us African, our hair is very kinky. We always put some chemicals, to make it look straight like yours, Dr. AREZO. Or hair color, hair dyeing. Is this something that could also cause breast cancer?
See, I will tell you that the recent study published by National Institute of Health in 2019 suggests that women who use this permanent hair dye and chemical hair straightener, they are in a higher risk of developing breast cancer. So this is the result of the study. So this means that, yes, we have to consider, but this means the people who are using too much of this chemical, permanent hair dye. So yeah, especially this should be into consideration for the women who are in the higher risk of the breast cancer. If already we know that we are in the higher risk, so it advised not to take this permanent hair dye too much, or this hair straightener. It's better not to take it, because the study obviously shows that there is the increase the risk of developing breast cancer.
Wow. Okay. Well, there you have it. I think I will let my hair just be an African hair, the way God created it to be kinky. It's so hard, AREZO. It's not even funny. But it is what it is. We want to be healthy, and we want to be wise in how we live life as well. So thank you so much, Dr. AREZO, for taking your time to share all this information with us. I'm sure it's going to be encouraging for all of us, especially for us women. And for the younger women as well, this is a conversation that you should also listen and get some tips. What will be your last advice to women who they are watching now, or they're going to be watching later, young women? What can you advise them? Because, for me, the cancer, sometimes I just say it's such a devilic thing, honestly. It's something that you don't even want to hear about it, honestly, and we don't want to be ignorant. There are people who they might be battling this disease, or they know someone who is going through this disease. So how can we better support,
the only things that I think, especially the women, the ladies, or whoever take care of their health, I only advise to equip themselves with the knowledge, with the knowledge of the disease. So right now, everyone should have a little, at least, few information about different diseases and cancer, especially for the women. We should know just enough information about some cancer, which is, it's more common in the women, like breast cancer, ovarian cancer, HPV, which make the cancer. So these a few things we have just to get more knowledge. And once we have knowledge, it doesn't mean that we should escape from, or we should scare from cancer. No, if we know about it, when we see some sign and symptom, we can easily prevent it in the early stage. And the cancer is not that much scary if we know about it. So I think that first of all, the knowledge, and then healthy and lifestyle. Healthy lifestyle is the best way, even because then later, if when we talk about or when we read about ovarian cancer and other cancer, one of these things that which is very important to reduce the risk is be physically active. So means this lifestyle, physically active, is really important for the women. So this is, I think, my advice for all women.
Thank you so much, Dr. AREZO, for taking your busy schedule time and, scheduling a bit of your time with us. I really appreciate your time and for having this conversation on Fauza Diaries with me. I appreciate you so much and thank you for sharing. And I really hope for you, my viewers, that you have learned something today on this conversation. October is always the month that there is a lot of emphasis, a lot of awareness happening. I know in UAE specifically, there are places where you can actually go, and get screening for free. So let's take advantage of this month really, and just get ourselves checked. I've become very careful because my breasts, they're full of issues. So I've become very, very careful. I see my doctor every 6 months. I have appointment with my doctor, Emma, and I mean, it's not something that I had hoped for, but this is just something that it has happened, and I'm very mindful about it. And just do your part. If it's exercise, eating healthy, as Dr. AREZO said, do your part. The rest is in the control of God, because we can't control everything on our own. And I hope you'll be encouraged and that you will share this conversation with someone else who may need to hear about this word, this conversation, and just go get screened. It's free in UAE. I know there's some places where you can just walk in and get screened for free. Thank you so much. Take care of yourself.
Thank you.
And thank you so much, Dr. AREZO, for sharing with us today. I'll see you guys soon with another Fauza Diaries, another inspiring conversation once again, just like this. Be healthy, be safe, move around, don't be lazy. Some of these things we can control, like Dr. AREZO said. Some we cannot. Do your part. That's all what I can say. Stay safe, and I'll see you guys soon. Bye for now.
Thank you. Bye-bye.